Hello everyone, my name is Seema Hussain and I will be your public health preparedness trainer. Today we are going to discuss Legionnaires disease, what it is, who is at risk, how it spreads, and most importantly, how we can prevent and manage it in a healthcare setting. What is Legionnaires disease? Legionnaires disease is a severe type of pneumonia caused by Legionella bacteria. It spreads when people inhale tiny water droplets that contain the bacteria. These droplets can come from sources such as cooling towers, hot tubs, whirlpools, plumbing systems, fountains, and water tanks. Rarely, Legionella can cause infection outside of lungs. Sometimes it can affect heart too. Legionella was first identified in 1976 after an outbreak at an American Legion convention in Philadelphia. Many attendees developed severe pneumonia and was later named Legionnaires' disease. What causes Legionnaires' disease? The bacteria responsible for most cases is called Legionella pneumophila. It thrives in warm water environments like hot water tanks, heaters, cooling towers in air conditioning systems, decorative fountains, drinking water systems. People do not catch it from other people. That is, it is not contagious. It spreads only from breathing in contaminated water droplets. Who is most susceptible? Each year, about 25,000 people in the US develop Legionnaires' disease. However, many more are exposed but experience mild or no symptoms. The most vulnerable group include older adults 50 plus years, people with a weakened immune system like cancer patients, HIV positive individuals, transplant recipients, smokers and people with chronic lung diseases, patients with conditions like diabetes, kidney disease. Who is most at risk in the healthcare settings? In healthcare setting, the risk is even higher for because the patient already are having a weakened immune system, and there are elderly patients receiving medical care, healthcare workers exposed to contaminated water sources, visitors who may have underlying health conditions. The incubation period, the time from exposure to symptom, is 2 to 14 days. It's important to note that Legionnaires disease is not contagious from person to person, but outbreaks are linked to contaminated water sources. At first, the symptoms seem like flu, including headache, muscle aches, high fever up to 104 degrees Fahrenheit. After a few days, symptoms may worsen, causing cough, sometimes with mucus or blood, shortness of breath, chest pain, nausea, vomiting, and diarrhea, confusion, or mental changes. As mentioned earlier, Legionnaires' disease mainly affects lungs, but in some cases, it is also seen to spread to heart and kidneys. There is also a milder form called as Pontiac fever, which does not infect the lungs but causes flu-like symptoms that clear up in 2 to 5 days. So, how do we diagnose this? Since Legionnaires' disease is a type of pneumonia, diagnosis requires a chest X-ray to confirm pneumonia, urine test or a lab test on sputum or lung fluid to identify the Legionella bacteria. Treatment involves antibiotics, and early detection is key, especially for high risk individuals. Complications may arise, which include lung failure, septic shock, acute kidney failure. Unfortunately, about 1 in 10 people who develop Legionnaires' disease do not survive. If someone contracts it while in healthcare facility, the fatality rate is even higher. Why is this important to clinical staff and patients? Legionnaires' disease can cause severe pneumonia and can be deadly for vulnerable patients. Preventing infection ensures patient safety and compliance with health regulations. To protect staff and patients, we need to focus on prevention. Use personal protection equipment when working with systems. Follow proper hand hygiene and infection control procedures. Regularly inspect and maintain water systems. Implement staff training on Legionella prevention. The good news is that Legionnaires' disease is preventable. By staying informed, following proper hygiene and water management practices, and educating our staff, we can reduce the risk and protect our clinic and community. Let's all stay proactive in preventing Legionnaires' disease. Thank you for your time. I'm happy to answer any questions or concerns you may have. And you can also go through my resources mentioned here on this slide for any more information on this disease. Thank you again.